Healthcare and spirituality or Christianity has been separated by litigation, by several man-made things.
All around the world, we can see the great disparity in terms of health. I oftentimes say that America does not have a money issue. It's really a heart issue as to what is our priorities, what do we really want to see happen.
Offering health care is such an essential part of the ministry of the church. Just as Jesus taught, he preached, he also healed.
And so I like to look at it, a third of Jesus' ministry was all about health. Well, if a third of Jesus' ministry was about health, I believe that the church ought to make that a part of her heartbeat as well, is to be concerned about the health and well-being of our people.
The healthcare system in the United States is broken. If you live well and you're well insured, you may not recognize that it's broken until you go to the hospital and a provider you've never seen looks at an x-ray and you get a bill that your insurance won't cover. Maybe you're one of the fortunate ones with options, but if you live paycheck to paycheck and you don't have any insurance, the reality of the broken healthcare system is going to break you, and you are going to experience this every single day of your life.
A lot of the people in our community have many barriers to accessing care. Cactus was what is known as a medical desert.
I never knew, living only an hour away, that there was a community like this in Cactus.
We have about 26% uninsured rate.
Statistics of about 17% of our county being underinsured and uninsured. A lot of people don't know the need that is there in the area of those who are in that gap.
We have a very high level of poverty in our city. It's a historic thing. It's not something we created overnight. And Memphis has had to pull together to care for its own for many, many years now.
Oftentimes, when you think about health insurance, you have those with insurance, those without insurance. But more importantly is what we call the working poor, people that are earning a living for their family, and yet because of the high cost of health care, they are unable to really reap those benefits.
12% of Americans don't have health insurance, and of those that do, almost 1 out of 4 aren't able to afford premiums, co-pays, or medication. These people are vital parts of our communities, and their poor health affects us all.
We see it impacting even a county like DeSoto. The needs are there.
You should care about your neighbor. If you have insurance and your neighbor is sick and they're not paying when they go to the hospital, guess what? Someone eats that cost, someone pays for it. Your premiums will go up.
I wish that more places really tried to help the community in their city, because what that shows is that everybody is doing better and everybody feels better.
Everyone, no matter their circumstances, should have access to quality health care.
We are documenting the redemption of healthcare one by one in communities across the country. By doing this, the movement will grow. Future generations will look back on this time as a crossroads in our nation's history, as a time when the healing began. Being a part of our mission means shining a light on the healthcare epidemic in America and helping others navigate the obstacles to opening a faith-based charitable clinic in their communities. ECHO has helped open over 100 charitable clinics with hopes to double that in the next 10 years. This is your opportunity to join and support a growing wave of patient-centered, generous, effective health care. Would you join us in bringing these stories to life?